My name is Dr Monica Stransky. I am a homeopath and iridologist. So iridology is a form of diagnosis. It's a diagnostic tool where we basically analyze the color and the fiber structure of your eye. And by doing that, we can see your genetic strengths, your genetic weaknesses. We can see what the body is going through at this point in time, where the toxins are, the acidity levels, all sorts of information we get from the iris. And by using that, we can then sort of form an action plan to make sure that you are in the best possible state of health, whether we use supplements, dietary changes, homeopathic remedies, chiropractic manipulations, whatever it might be, whatever modality you need to use to try and bring your system back to balance. So if you can see that genetically you are prone to something, or there's a disease process that you are prone to, we know that there's multiple ways these days that we can use to halt those disease processes or alter the disease process so that we can try and prevent that ultimate, or delay. In some cases you can't prevent, you can only delay, but that's fine too. I mean, you know, if you were going to have diabetes and you were going to get it in your 60s, but you can delay it till you're 89 and you may end up dying at 81, you know, brilliant. You know, that's kind of the aim in life, is to try and delay anything or potentially prevent it. The history, it's ancient. There are reports of it being seen in the hieroglyphics in the Egypt, in the temples, right? Sanskrit in India, way back when in the 1600s. But what we see as the sort of, I suppose, westernized father of iridology is actually a guy called Ignaz von Petzli. At the age of 10, he found a barn owl and had a broken leg. He splintered it, he looked after it. Now, an owl obviously has a really large iris. So he noticed marks in the eye, and as this owl healed, these marks changed. So this fascinated him. He went on to become a physician, a doctor, not a homeopath, nothing fancy, just a doctor, and started looking at all his patients. And he would make notes of what he was seeing, the color changes, where the condition was. So for example, if he saw a person with a kidney issue, he saw a mark in a certain sector or zone of the eye. And that's how the first sort of iris map was developed. The body is basically divided into a map, and different sections of the map reflect different body parts or organ areas. So what we do now is we look at those areas, and then when we see a mark in them, we can say, right, this is in your kidney zone, this is in your liver zone. And then we extrapolate from there based on what the mark is. We can say, is it an inflammatory sign? Is it a defect sign? What sign is it as to what could be the problem? Right, so when a patient comes to me, I'll first give them the story of the history and how it works. And then I will ask them to come and sit by the microscope to do the iridology the actual analysis section. Slide yourself behind the microscope here. Pop your chin on here for me. That's it. You're going to look straight ahead. I basically shine a light in your eye, but don't look in the light. You're going to look in here or past it at the wall. I'm going to ask you to blink and breathe as normal, right? So then I will basically use these dials to focus so I can see the iris clearly. And then I would make my notes and drawings for my analysis so that I know what I'm talking about. So once we see exactly what we're dealing with, what the strengths are, what the weaknesses are, where the problem areas are, what we then do is we either refer you to someone like myself, a homeopath, who can then, with natural remedies, supplements, dietary changes, potentially alter that pathway. That's pretty much the best way. If we see something and we're not 100% sure what it's going on, I do also refer occasionally if I feel it needs more investigation. So then it would be blood tests to further investigate, or x-rays to further investigate, or sonars, or even referring to a specialist if it's needed.